Hello there, and thank you very much for opening up this video. I really do appreciate it. For those of you who don't know me, my name is Bond, James Bond. I'm a health and fitness expert based in the United Kingdom. I'm making this video today because of this article that came out in the iNews yesterday. It shows how Welsh rugby legend Gareth Thomas came out as being HIV positive. He had previously come out some time beforehand admitting to be gay, which I really do admire. As you can see from this video, I haven't shaved because I'll explain why. This newspaper article brought up a whole range of emotions about my HIV scare some time ago, and I want to tell the general public basically what I went through. And I want you to just, he's had no end of support from the general public, which I was delighted to see. And I want you to just consider just how society has moved on, because had I done that when I had my HIV scare, trust me, things would have been very, very, very different. So let me explain what actually happened. When I was a medical student, I had an attachment at the Northern General Hospital in Sheffield, and I had this registrar who was bullying me. He had actually told me that no matter what I did on that attachment, he was going to have me failed. What he didn't know is at the time I tape recorded him saying that, and sometime later on I actually challenged him on that with the taped evidence. Taped evidence is very persuasive in court, I can assure you of that. So first of all, let me tell you about Gareth Thomas admitting that he's gay. I really admire that. I pride myself on having friends of all sexual orientations, whether they be straight, lesbian, gay, bisexual, or whatever. I do have a friend who describes himself as trisexual. Now you might wonder what that means. It means he'll try anything. And I mean he'll try anything, he literally will, but that's a different story altogether. I'm just reading from my notes because the thing is, I haven't. You can see I've got a bit of a beard. I've got stubble. I've been up all night worrying. The reading his article has brought back a flood of memories of what actually happened to me when I was a student. Let me explain. As I said before, I had an attachment at the Northern General Hospital in Sheffield, and I had this registrar who was bullying me during the attachment. One night I was on call, and I had to take a load of blood samples. Now, I was always told that it was good, safe practice to always wear gloves when you take blood samples, obviously identify the patient, label the blood bottles properly, take 2 kidney trays, put your stuff in one side, in one, the waste in the other, and take a sharp spin to the patient, dispose the needle on the spot, and then done and dusted. And this guy didn't like me doing that, and he was mouthing off at me all night long. And he made me so nervous that I pricked myself with a needle. And trust me, I started the fear of HIV infection. Now, when I stabbed myself with a needle, luckily he didn't see me do that. He got bleeped and he had to go and operate urgently. And to be honest, I was glad to see the back of him. So that was bad enough. And I then made my way home, and in the car park I got assaulted. Wasn't too big a problem because I gave the assailant an absolute thumping, so he went by the wayside. But when I got home, I rang up occupational health, who basically told me to speak to student health. I got them on the on-call service, and they said to me, told me to speak to student health. Student health told me to speak to, in the following morning, told me to speak to occupational health. What am I going to do? So what then goes and happens is my dad is a doctor, a GP. So he spoke to him. He just said, phone GU medicine immediately. And I did, and they were wonderful. They said they got me in really, really quickly. And they took a full history and everything, and said, we think your risk is low, but that doesn't make just because they say the risk is low, it doesn't mean that you don't worry about it. In those days, the treatment for HIV is nowhere near as advanced as it is now. And on top of that, in those days, the delay between the test, and the result was 3 months. So for 3 months I went through a living nightmare. Actually, it was more than 3 months, now come to think of it. So what happened was, everything fell apart. I didn't know one day to the next if I was going to be alive the next day. Every time I went to bed, I was worried, am I going to be alive the next morning? To quote the James Bond movie, am I going to live to die another day? And I lost weight, I couldn't eat, I wasn't sleeping properly, and I couldn't tell anyone. My dad knew, GU Medicine knew, but I couldn't tell my professional colleagues. I would have been treated like a leper. Mind you, I wasn't anyways. It wouldn't. I was very much an outcast when I was a medical student. So then what happened was, I wasn't sleeping, I wasn't drinking water. I'd really gone into self-neglect. I was worried like mad. Now luckily we were on a lecture block, so I skipped the lectures. I just couldn't face anybody. I couldn't tell anyone what to do. I couldn't even say my own GP, because you tell a GP of this sort of thing, they've got to put it on the medical record, and you can say kiss goodbye to any life insurance, and they would inform the medical school, and I would risk getting kicked off the course. To make matters worse, I couldn't even go and see any form of counselling service, because in those days, if you saw counselling services and they thought you were a risk to patients, they'd inform the authorities. So there was nowhere I could actually go. I only found out later on that the university counselling service wouldn't have done that, but that's a different story altogether. So there was nowhere I could turn, nowhere I could run to. So I was all alone. But the only people who knew were GU Medicine and my dad. But I had to put on a brave face. I had to act towards people as if everything was normal. In lecture blocks, you can avoid not going in. But you had to go to tutorials where basically attendance was monitored, and I had to pretend everything was normal, which everything wasn't. To make matters worse, on that year, on January the 3rd, 4th and 5th, I believe, I remember, we had exams. Very antisocial time of year to have exams, by the way. But we had Christmas. Now, if you've ever seen the movie called Titanic, you will no doubt remember that Rose was saying that everyone was in a joyous mood, but for her, she was screaming from her lungs, but no one was listening to her. I was in the same situation. So Christmas was horrible for me. I didn't know if it was going to be my last Christmas, and it was no surprise. I didn't pass those exams, and I found myself on the pass-fail Viva list. Pass-fail Vivas are basically where they have an oral examination with 3 examiners to try and bring you up to a pass mark if they can. There was no way I was going to pass. No way. I couldn't submit a medical note to the medical school because I risked being thrown off my course. To make matters worse, I then had an attachment, a surgical attachment, and to make matters worse than that, one of the consultants on the attachment was the dean of the medical school. So deduce from that what you will. So, and at the end of the month we had exams where you had to examine a patient, and as things went on top of me day after day, eventually I broke down one day, and I went into the medical school and I served my notice. I said, I'm going. I can't take this anymore. I was worried about if I was going to be alive next day. I just failed the exams and had more exams coming. I just couldn't take it anymore. And this lovely lady at the medical school said, what's the problem? And I just said, this is it. And she promised to keep it confidential. And with my consent, she rang up the GU Medicine, who said to her, he's at low risk. He can do the exam. He's not a risk to patients. So now, although there were gaps in my knowledge, the clinical exam at the end of January was simply, could you demonstrate how you could clinically examine a patient? And I was very, very good at that. In fact, I remember that exam very, very well when one of the examiners asked me to do a neurological examination. And he actually said to me, "Who taught you to do that?" I said, "My dad did. He's a GP." And he said, "I'm a Royal College examiner. I haven't seen postgraduate doctors do it. What are you doing this as a medical student?" So I passed that. There was no problem. But then obviously that attachment, which I did, I hardly attended, and I failed it. I'm sure I did have failed it, because in those days you examine attendance, knowledge and attitude, and I didn't attend. By the time I'd handed my notice, I just didn't care. So what then happened was I think the dean must have realised or something. I don't know what happened. So what then happens is I have another attachment at a peripheral hospital, and on the first day I said to the registrar, who was a nice guy, I said, "What can I miss? I've got resits coming up." Had I failed that clinical exam, that's it, I would have gone. And he just said, "This consultant takes no interest in you at all, just go home." He just said, "If you are going to attend, just stay in the library." Anyway, on the Tuesday we had a ward round with the consultant. I thought I'd just make an appearance, and as he went into the ward, I saw the back of his head once, and he just said, "I don't want the students." So I thought, well, fair enough, stuff this for a lark. So I went home to do some work, and the following day a letter arrived from the medical school. I thought, oh God, I'm being thrown out here. And it was a letter basically saying, "Here are a list of tutorials for the resits. You are strongly advised to attend." Fine, not a problem. I didn't go into that attachment at all. I was revising for the resits. So what then happened was I was revising for resits, and then I had my follow-up appointment with GU Medicine. And for the preceding 3 or 4 days, I went through every emotion. I thought, is this going to be my last day? On Friday, am I going to be told I've got a death sentence? How much longer am I going to have to live? And I went in, and I went to see the doctor, but there was no doctor there. There was just a nurse, and she opened up the result and says, "It's a negative result." Now I couldn't sit down during that appointment. I was standing up. But when she said a negative, I broke down into tears. As I can see, I'm starting to cry now. And I literally fell to my knees. And this nurse got up, and she says, and she got up, and I just started crying. I couldn't listen to anything she said. And what happened was she hugged me, and it was the first time, I had my life back. First thing I did was I went to the university canteen and got myself a good slap-up meal to celebrate. And I had about 3.5 weeks before the resits, and trust me, in those 3.5 weeks I learned a whole year of medicine, pathology, immunology, med micro, pharmacology. I learned it like there was no one's business. I had my life back. I remember in one of those tutorials, this guy called Dr. Reed, or was it Professor Reed? I don't know, I can't remember. And he was teaching us on urinary tract infections, meningitis and tuberculosis. And when the exam came, there was on the essay paper, there were 4 essays, of which you had to answer 3. And one of them was on tuberculosis, one was on UTIs, and one was actually on meningitis, and it was great. So that was no problem. The practical was no problem. I'd attended loads of autopsies when I was a student, so that was absolutely no problem. What let me down was the multiple choice. In those days, get it right +1, get it wrong -1, abstain 0. And that's what let me down. So I faced the pass-fail Viva, and there were 8 people listed for a Viva that day, and I was the only one who passed. So that says something. And how to put this, but I went through a living hell for those few months. So just a second. But this brings me to a couple of incidents. Okay, when I was a what do you call it? I'm just looking for my notes now, because how to put this. when I was a junior doctor. I remember one incident very, very well. What actually happened was, there was a patient on my ward who we found a low iron level. It was an incidental finding, and he'd learned to live with it. So I just said to the my team, vitamin B12, iron, folic acid, come up normally. Oh no. They wanted him to transfuse this guy. I'm not breaching confidentiality here. One, this patient is no longer with us, and two, his wife actually testified to what I'm about to say before the House of Commons Select Committee on this. And you can't breach confidentiality of something that's already in the public domain. And I was overruled, and he was transfused. Anyway, I then proceeded to do a week of nights, and then one day when I was about to finish my shift at 9 a.m, my consultant came up to me and he said, "How much contact did you have with this person?" I said, "Well, just Dr. Patient stuff." I said, "He's HIV positive." I thought, oh God. And I thought, oh my God, what's happened here? So anyway, I then had a week's leave. I came back on my ward. I went to see the patient and said, "I'm really sorry what happened." And he said, "I'm sorry too." And he then said, "I wish they would have listened to you, but I was only a house officer. What are they going to do? Listen to me? No, never would." A couple of days later, I was asked to take a blood sample for this patient, so did. No problem. Universal precautions. As I said, take a sharp spin to the patient, use universal precautions, and dispose the needle on the spot. Great, no problem. A couple of minutes, and then obviously what I did was I labelled the bottles with a yellow sticker, danger of infection, labelled the blood form. I hand delivered everything to the path lab. I said, "This is a category 3 patient, please be careful." And a couple of minutes later, this Jobsworth lab technician came on the ward and said, "This man is HIV positive and I am not risking my staff by doing this blood sample." And I had my head like this and I said, "Great, fantastic. If you spoke any louder, they might have heard you in Australia. I now have to transfer this man to another hospital. He was being treated like a leper." And so that's exactly what I had to do. So now you know what it's like to go through the risk of HIV infection. Now, as I said, I have many friends from the LGBT community, and I pride myself on good relations with them. I've actually refused membership on my fitness program to people who don't like gay men. I live stream fitness classes across the internet from my studio into people's living rooms. And I actually did have a lady say to me that she didn't want to be taught by a gay man because I thought, hang on. I just said, "You can see us, we can't see you, and it's across the internet. There's no risk of anything." But she said no. So I said, "Well, this program's not really for you then." Put the phone down, blocked her on social media and email and the like. But this Sunday coming up, I'm doing a video blog on how to avoid HIV infection. If you go below, you can see a link on how to get onto that list. HIV is very, very easy to avoid, believe it or not, if you know how to do it. And HIV infection is a bit harder to get than what you might think, actually. So please do not we will. This has been a very, very difficult video for me to make, probably the hardest one I ever have had to make. Seeing that newspaper article brought back a whole load of horrible memories for me. And I hope no one to God actually go through the same thing. Actually, the guys who lied on oath against me, I hope they go through that. I don't have a problem with them, the guys who lied on oath against me, going through the same thing. I have no problem with them being found HIV positive. But they're the only people in this world who I want to see go through that. I wouldn't want anyone else to go through that. Thank you very much for your time and attention for watching this video. Please be kind enough to write your thoughts below. And I want to say thank you for your time. and God bless. Speak to you soon. Bye bye.